We're fortunate to have Dr. Joseph Betancourt with us today. Dr. Betancourt is the Vice President and Chief Equity and Inclusion Officer for the MGH. So Joe, thank you for spending this time with us. I know you've been running pretty busy these days, but we appreciate your time. And maybe we can start the conversation by having you give us your perspective on how the recent events that we've all lived through have influenced the work that you're leading in diversity, equity, and inclusion for our institution.
Great. So thank you so much, Marcela, for this time. I appreciate it, and I appreciate our longstanding in friendship and partnership. And so it's a pleasure to get a chance to speak with you. Briefly, I just say that, clearly, if we turn the clocks back to March, we understand that, recent events have really, I think, shed a very significant light on the work that I've had the pleasure and honor of trying to lead since I was appointed last May, which is the work of diversity, equity, and inclusion. When the COVID pandemic hit, we saw both locally and nationally how COVID disproportionately impacted minority and vulnerable communities, again, across the nation for a whole bunch of different reasons that we've talked about, including the impact of structural racism, social determinants of health, such as, issues related to living in densely populated areas, having extended family in the home, being essential workers, not having the capacity to socially isolate, being on the train before mask use was recommended or required. And all those, I think, factors led to what we've seen here in our environment, particularly in Chelsea and Revere. And I'm pleased to say that we really rallied as a community to meet the needs of our diverse populations. Our physicians, I think, our nurses across the institution, everybody rallied to the care of our communities, building capacities to address language, standing up a Spanish language care group, investing in and thinking about ways in which we can communicate with our employees who didn't speak English. So, I think that was really exciting. And I'd say that we were just coming out of that when the murder of George Floyd pivoted us squarely on issues of racism and structural racism. That's led to a whole new series of conversations around our commitment to racial justice, to equity, our commitment to an anti-racism portfolio of work. And that's what we've been working on.
So how specifically, Joe, would you say that your work has been you talked a little bit about, how there's been some, maybe redirection of some of that work, but specifically, could you speak to what has taken place over the last few weeks?
Yeah, so May 25th, George Floyd is murdered. Within the first 2 weeks here, we did all the requisite things that many institutions did around the country. We sent messages of support to our community. We had a moment of silence. We did a kneel-in. But what I want to really draw everybody's attention to is we quickly pivoted towards bringing forward a slate of actions that were built on, decades of great work here at MGH, input from strategic plans in the past, input that we got after the murder of George Floyd, that I think ended up in what we called our MGH draft Structural Equity 10-point plan, a portfolio of 10 efforts that range from small efforts that we were already discussing to larger transformative efforts to things that we've been talking about for a lot of years that we haven't fully executed on. So that 10-point plan was developed. It was put in front of our leadership. We've presented it in over 40 meetings over the last 3 weeks, gotten input from over 850 individuals across our institution with thoughts and ideas through a survey that we put forward. And we're now at a point where it's been endorsed by our board, and we are reconciling our 10 points with a similar set of recommendations from the Brigham, an effort at MGB called United Against Racism, and some other work that was already occurring at the system level around diversity, equity, and inclusion. So it's exciting. I think we're coming to a head now to chart a new path for us as an institution around all these issues.
That's terrific, Joe. And I think we so appreciate your leadership. And I know that you've spent probably every waking moment over the last few weeks beyond your previous commitment to this work over the last several weeks. So what's next, Joe? And maybe if you could speak a little bit to our clinician community, what message would you have for that group?
Yeah, I think a couple of messages. I'd say number one, this work really is about our values. And I'd say over the last bunch of weeks, I haven't met any caregiver who hasn't said now is a time for change. The urgency of now is upon us, and we need to do better as an institution, as a society, in living our values of equity and justice. I think that's incredibly important. I'd say that this work cannot be done by any 1, 2, or 3 leaders. This fundamentally requires that we as a community stand up and hold ourselves, our leaders, our society accountable for the changes that we aspire to. And so I would say everybody stay tuned, stay engaged, but we really, really, really need people to not only educate themselves about racism and these factors, which are incredibly important, but really stand up for how MGH will live our values, be anti-racist, commit to equity, commit to diversity, commit to inclusion in ways that we've never done before. And I look forward to that partnership.
Great. Again, Joe, thank you so much for your leadership, your indefatigable, I would say, dedication to this work over the last 2 decades plus, and especially these days, we're just so fortunate and privileged to have you here leading this work forward. And thank you for your time, sharing your perspectives and your work over the last several weeks with us. We so appreciate it.
Thank you so much for your partnership and for the kind invitation. And I look forward to working with everybody to advance this important work in the days and weeks and months and years to come.
Great. Thank you, Joe.
Thank you.